Hey YouTube, it's Marita and welcome to another edition of the Nurse Lounge. Today we're going to do a video on nursing judgment versus nursing policy. And if you want to know what I mean by that and why you should govern yourselves a certain kind of way depending on the situation, then stay tuned. We're back. We are now going to talk about nursing judgment versus nursing policy. So nursing judgment or nursing policy, let's stick with that first. Nursing policy is basically policies that are put in place by usually your institution, corporate, whoever, to say this is how we as nurses are going to govern ourselves accordingly in our facility. Meaning it talks about nursing scope of practice. It talks about your interventions, how to do them, process and procedures and things and such. It includes your order sets from physicians. This is how we're going to do this. We order this. We're going to do this every so many hours. Vital signs are Q4 at 8, 12, and 4, or 10, 2, and 6, or whatever time, or maybe they're every 6 at 12 and 6. Those are your policies that kind of govern you as a nurse. Nursing judgment is not like that. Nursing judgment is basically taking a situation and say, hey, based on this certain patient situation, what am I going to do in regards to handling that situation within the scope of your license? So keep this in mind. So a nursing judgment example would be, I'm someone who does not give narcotics upon discharge. So I catch a lot of slack from that from my coworkers, and I don't care because I still have a license. So what do I mean by that? So let's just say, for instance, you have a patient who is getting ready to go home, and I say she because I'm an OB nurse, she decides that she wants a Lortab to go, shall I say. And I'm someone who I will not give Lortab for you to be discharged out the hospital. If you want your Lortab, you will have to stay at the hospital for another couple of hours, and we see how that works for you. And then after that, then you have the ability to leave. But when it comes to me, I will not do that. Here's why. So when it comes to, let's just say, a narcotic in general, we all know that those narcotics cause respiratory depression. It causes your blood pressure to go down. It causes your heart rate to go down. Typically, your O2 sats can drop some. And of course, your respiratory rate definitely does decrease when you take narcotics. Not only that, it causes drowsiness. It has a side effect of drowsiness, which is known for most, if not all, narcotics. So with that being said, I'm taking a patient out to her personal vehicle, okay, to go home with her new baby and whoever her support person is. I have had patients tell me I'm driving myself home because I drove myself here. Now, do you think I want to give somebody a narcotic for them to go drive themselves home? Absolutely not. Because when that medication can hit, she could have a delayed reaction in terms of her stopping and therefore have an accident, kill herself and the baby. Now, I know this is a hypothetical situation. Can it happen? Yes, it can. Has it happened to me? No, it hasn't. And it's not going to, because why? I practice nursing judgment and I don't do such. Another scenario is you say, well, maybe the support person's driving. She doesn't have to be driving. I have had people tell me that they've switched positions because she wanted to drive herself home after the fact. My point is this: once you get to that car and you drive off, I don't know what happens after that, but I'm responsible, because when she gets into a car accident or something happens and they do a toxicology report, they see that she has, hydrocodone in her system. And then they go and look and see what time the last time it was administered, and it was administered at 10 o'clock and she left at 10:02, as an example. Then guess what? I gave that, and she is driving under the influence. Driving under the influence. I'm responsible for that. Another situation. Let's say I gave her that said hydrocodone like we just talked about. And let's say that she goes to the pharmacy and picks up her prescription and says, you know what, this pain medication ain't working. I'm going to take yet another one. And what if they're Norco 10s or Lortab 10s, okay? So the Lortab 10s, now she's gotten 2 pills within a short period of time, and it will make that effect go in even more in terms of her having the effect of this medication, and I am not signing off on that. So nurses are so mad at me when I say, no, I will not do that. Patients get mad as well. I said, I'm sorry, I'm not going to do it. I'll see if I find another nurse who doesn't mind giving you your medication. And if they don't mind, then that's going to be on them and their license if something happens to them. But I'm not going to do that. That's called a nursing judgment. I will not do that. If something happens to you, then I am liable. Now, I just worked the other day, and I will link that video here when I worked my little 6-hour shift. And in that video, I found, or in the video, I didn't mention it in the video, but that particular shift, I learned that they have made that nursing policy now where we have to give medications no matter when they want them, even upon discharge. And guess what? I'm still not going to do it. I'm not going to do it. I don't care what the policy say. It's unsafe. That policy is unsafe because if something happens, when they make an example out of you, they're going to make an example out of you. When something happens, keep in mind in nursing, a lot of times we are not proactive, we are reactive. Meaning, okay, now that it's happened, now let's go change your policy on this. I'm not that person. I'm a proactive type of nurse. So therefore, I think ahead of the situation and say, okay, I'm not going to do that because I'm not going to risk my license. So they have now changed it at our facility that this is now nursing policy, not nursing, not that you're not allowed to not give them their medication. But their option for me, and I tell them that up front, if you're leaving today and you want a narcotic, you will have to stay. If it's not time for you to have one, or if it's time right before discharge, you will have to stay an additional 2 hours after the fact. And I tell my patients that all the time, and they make a decision early what they want to do or not. If it's a Motrin that they're available to have, they can have Motrin or Tylenol. I will give them that. They can walk out the door, not a problem. And then they can take their narcotic once they get home from the pharmacy. So I do practice those types of things. You have to remember when it comes to nursing policy, that is what the hospital or corporation is saying. This is what we want you to do. It doesn't mean it's there to protect you. It does not mean it protects your license. The only people who protect your license is you. You protect your nursing license. No one else does. So do you think that hospital has your best interest at heart? No, they don't. They have their best interest at heart. They have their bottom line at heart, not you and yours. So if you want to make sure that, and I tell nursing students that all the time, they think the hospital really cares about you. No, you are a peg in a hole. You are a nurse, you are a body that happens to have a credential of being an RN or LPN, and then you're filling a spot because what you don't do, another nurse will do. But guess what? When the other nurse kills somebody, then they're going to make an example out of her. Or him. Don't let that be you. Don't let it be you. Nursing judgment versus nursing policy, learn the difference. I do recommend you all go to your unit. And when you have downtime, you can find nursing policies typically on your intranet, your hospital intranet, or some facilities or units have a actual book, a nursing policy book, or both, where you can kind of flip through that book on your downtime and see what the actual policies are regarding your scope of practice for your unit at your facility. And the rest of you, like I said, go to the intranet if you have that and look on there, and you'll have your nursing policies on there as well. I do read through nursing policies from time to time, but I've been at my facility now for about 15 years. Or 14 years. So therefore I pretty much know them, and they update us when new policies do come out. But again, there's certain things that I won't do because I feel like that is a nursing judgment. At the end of the day, they're going to jeopardize my license, nobody else's but mine. One other example is this. You have a patient who says, you know what? That Lortab 10 was entirely too much. Can you cut that in half for me? And some people feel like, well, it's less than the dose that's ordered. So yeah, you cannot do that. The ordered dose says, if the dose said, or the order says Lortab 10 Q4 hours PRN as needed for pain, that's how you have to administer it. You can't cut it in half and give them half and dispose the other part. That is illegal because that's not what the doctor ordered. If you want to give them half of a pill, you have to call the physician and get a new order for a 5 milligram tablet to give them. And then that's how you administer that. So I won't do that. Again, it's a nursing judgment, that I'm not going to do that because it doesn't follow the order. And if nothing else, if you don't have anything else, you need to know how to follow doctor's orders. Now, even then, you may say, okay, the doctor ordered a 10 milligram of Lortab and your patient's blood pressure is 90/40. Well, if you don't feel comfortable giving that 10 milligrams of Lortab, then you don't give it. You call the doctor and see if I can get a 5 milligram Lortab or whatever else it happens to be, or maybe just give them a Motrin for right now. Be mindful of those things. You have to kind of do things like that because if you don't, then you are going to jeopardize your license. Nobody else's but yours. So be mindful. Look at policies. Look at your scope of practice for the state that you live in. I live in Tennessee, and I know our scope of practice is a registered nurse. Know your practice policies and your procedures for your job. Know what you're supposed to do, not supposed to do. And then you have to know, too, what is going to keep you safe in terms of your actual job. So in your license, nobody cares about your license but you. All right, this is all for today. Thank you for watching this video. My name is Dr. Marita P. Until the next time, you all take care. Bye-bye.